having a heart attack, even if you have normal heart muscle function, is a life-changing experience for a patient. And they're really anxious about returning to work, returning to their family, exercise, and even if they can return to having sex.
I find as a cardiologist that those few moments and few days after a person has a heart attack while they're still in the hospital are not only a very vulnerable period, but also a teachable period for patients. That's the moment where a patient is willing to hear about not smoking anymore, not drinking anymore, leading a more healthy lifestyle, working toward weight loss and a healthier way of living.
Usually we refer a person to cardiac rehabilitation because that helps alleviate some of the anxiety. Cardiac rehabilitation is an organized program of exercise, nutrition, and stress management, and it's covered by most insurance plans.
Either in patients that haven't been active at all or patients that have been super active and very, very fit. Both of those patients don't know how much they can do after a heart attack.
It's really important to exercise. Even though you might be concerned about it, it is actually part of the remedy because it will make your heart stronger again.
During my recovery process, I was just still trying to kind of wrap my head around the fact that I had had a heart attack, and then I had to slowly just start increasing my activity level. Cardiac rehab was really helpful to see how far I could push myself.
A lot of my patients ask, well, when is it okay for me to go back to a normal sex life? And typically after a heart attack, I say that they should follow up with their doctor about 1 to 2 weeks after.
Basically, having sex is equivalent to climbing 2 flights of stairs. If you can do that, you can probably have sex.
The same goes for driving. Once you see the doctor, if you're noticing that you're feeling fine, you feel back to how you were before the heart attack, we say it's safe for you to go back to driving again.
It's really, really important, though, that these decisions are individually based on the patient, what the risk factors are, how big the heart attack was, how much damage there was to the heart, and therefore we can't make a blanket statement about how active patients should be immediately after a heart attack.
It's very common to feel anxious, stressed, or even depressed after a heart attack because it's a life-changing experience. We know that treating stress, anxiety, and depression in the setting of someone who's had a recent heart attack helps improve their ability to go out and engage with their family, as well as return to exercise.
Just because you had a heart attack doesn't mean your life is over. And that doesn't mean that you can't do and continue to do the normal things you were doing before you had a heart attack.
You should take it slow, you should really listen to your doctors, and you will get back to your regular life in most cases, but you just have to be mindful about how quickly or how slowly to do that.